Guys, welcome again to my channel. So I nearly did not do this video. I was so tired. I mean, the week was so busy. To make matters worse, I've signed myself on a new course. The intention is to completely and utterly chock-a-block my life so I can stay away from trouble and from men. Now let's spring right into it. Today I'm going to talk about risk assessment for diabetes care planning, because you remember last week I did a video on diabetes care planning. Card will be up now, so you can click on that and watch that video. The first thing you need to be considering before you even start a care plan, which I'm not sure I mentioned in my last video, and also risk assessment, is mental capacity assessment. Now, if I am compass mentor, so for example, if I've come into your care home and I'm going to be living there, and you're assessing me and you're asking me my name and I'm answering all the questions and everything is okay, and I seem absolutely fine, but if you find that sometimes I'm in line with what I'm saying and other times I'm just like doolally with it, then the best thing to do is do a mental capacity assessment to make sure that I have the capacity to make a care decision. If you've done the risk assessment and somebody that you've done risk assessment for, it seems that they lack capacity, maybe they've got dementia, or maybe they're just confused and disorientated. It may well be because of the UTI, so don't forget to do a UTI test as well before you conclude, to make sure, because if it's just UTI causing the confusion and the disorientation, it may well be that once it's treated they will come back to normal, so you need to bear that in mind. But let's say that you've assessed them and they haven't got capacity, the best thing that you need to then be doing is best interest. And remember, you cannot do this by yourself, so you have to get their family involved, you have to get your GP involved, and so that all of you can make that decision together, that whatever care that you're going to be giving, for example, you're going to be giving them things like insulin, that you're acting on their best interest, because they may turn around and tell you, no, I don't want that injection. And often you find diabetics will react to insulin like that. But with best interest, you can actually go ahead and carry out that the drug administration. But obviously be careful, don't manhandle anyone, because it's abuse. You already know care planning and risk assessments are subjective, so people's care plans and risk assessment tend to look slightly different from each other. Sometimes you might find two people with similar care plan. Like for example, if one person is on has got a catheter in place and the other one hasn't, you already know that the one who's got a catheter in place, it's more prone to UTI than the other one, and therefore you will be doing a risk assessment for UTI, and you will also be doing risk assessment for catheter. So in terms of that, you can see that you've already had like two risk assessments in place, whilst the other one, who hasn't got a catheter in situ, can only just have maybe a UTI risk assessment if need be. I know that diabetics often are prone to protein in their urine and sometimes prone to infection, so it will be wise to put a risk assessment in place, especially if there's history of UTI. So make sure that is in place. I've now jumped straight into risk assessment number one, which is make sure that you have a risk assessment for urinary tract infection in place. If they've got a catheter, just to recap, make sure that you do a catheter risk assessments. If you're not sure how to carry out risk assessment, you can ask me on the comment box down below and I can do a video, or I can even send you personal link, or if I have your email or whatever, I can just send that to you privately so you can sort that out. Okay, I don't have to do a video on that. I have my list over there so to read them out, because I'm getting older, my memory is not as sharp as it used to be. Right, and the next thing is nutrition risk assessment. Now, if I'm eating really well, you don't have to do a nutritional risk assessment for me, unless, of course, if my diet is really poor or I am overweight, whichever way, then you can draw a nutritional risk assessment for me. But to be wise, or to stay in a safe place, I would normally do a risk assessment to say that the person is not allowed sugary meals, and it shows whoever that is looking at that care plan or any inspector that comes to look at your care plan that you actually being very thorough. Mention in your risk assessment they are not allowed sugar, but they can have sweetener and stuff like that if you really want to put that in place. But the people you need to be looking at are people who are losing weight, they're not eating well. Remember, if a resident suffering from diabetes is not eating very well, that can cause problem with the blood sugar balancing. And those who are on the big side, of course, you know that the more they put on weight, the harder the pancreas is working, and therefore, I mean, if they have type 2, because you know in type 2 the pancreas is still making some insulin but working super hard to squeeze out that insulin into the body, and if they've put on weight, pancreas is just going to be completely knackered. So you need to make sure that you help them manage their weight, in which case put risk assessment in place and help them with their diet. Okay, obviously in risk assessment you're stating what the risk is, and you're stating what you already have in place, and if that doesn't work, what you're going to do next. So it's pretty simple. The next one is medication. Obviously if they are just on metformin, metformin is pretty okay. However, some people can react to metformin. It can cause some tummy problems. I just completely forgotten what it's called in medical terms, but there you go. It can cause flatulence. It can cause upset tummy and stuff like that. And if they start complaining, obviously you need to keep an eye on that, and they can have a slow release metformin, and that way they can be more tolerant to it than the other one. So, but metformin does not cause hypo, so you need not worry about that. But if they are on glycoside, sitagliptin, I think it's called as well, that those can cause hypo, and therefore you need to do a risk assessment for them. If they are on insulin, definitely risk assessment needs to be done. Why you're doing that is to make sure that you're checking that the right amount of medication is being given and they are not going to go into hypo. Okay, so wound risk assessment, very, very, very important. If you've admitted a resident who has an existing wound, you need to assess that wound properly. You need to measure it, wound bed and everything, and document, and get your tissue viability nurse involved. Never attempt to heal a diabetic wound by yourself, especially if you're not particularly trained in that area, because that wound can get infected quite easily and can cause limb amputation, and you do not want that. So what you need to be doing is assess, make sure you protect that wound from infection, and get your tissue viability nurse involved, and they should be able to help you. I would actually get a podiatrist to help with the foot care, and also make sure that they attend their regular appointments, in which case all their feet will be checked as well. Final one is when they're unwell. They call it diabetic sick day. If a diabetic resident is unwell, the blood glucose tends to go erratic. Now you need to be doing a risk assessment of what you will be doing if you find out that your resident who is suffering from diabetes is unwell. Maybe high temperature, maybe it's infection brewing, something of that nature. What you need to do is write out risk assessment, and in that risk assessment I want to be seeing the fact that you're going to be checking vital orbs, which includes the blood sugar monitoring, and you're going to be getting the doctors involved, and you're going to obviously support them in making sure that they're eating well and they're taking their medication. It's pretty simple. I hope this video has been very, very helpful, because that is my intention. I know that the last video didn't do so well. I only have 50 views on that, and I think it's because maybe there are people who are more interested in my other videos than that, but because it was requested and this is the area of my expertise, I am more than happy to have put it up. If it is your cup of tea or your absolute delicious cup of coffee, hit that like button and show me that you actually like it. However, if it's not your thing, why don't you share it with people who might actually like it and benefit from it? Thank you so much for watching, and God bless you. Bye.